practice, you would have been handling difficult patients and difficult attenders, and we can see a steep rise in increase of violence against doctors. So, how do you think, as a postgraduate resident and as a junior doctors, we should handle such kind of difficult attenders and patients, sir?
Very questions for the postgraduate and those who are dealing patients in the corporate or private setup. I have worked actually presently I am working in a government setup. Before that, I have worked quite a years in the private setup. So it is very important, Venkatesh. It is very important to communicate with the patient and patient attendant. It is very important. So uh, what I say to my uh, junior doctors or postgraduates, that once you saw the patient, take out some objective means there are various scores. Yes, various scores for every disease, which will tell you what is the prognosis of the patient. I used to say them that you calculate it, and in an objective way you just explain the patient what is the nature of the disease, what is the chances of survival, what is the chances of recovering, what disability he or she may have after that in during the process. So explain them as objective as much. And once you saw the patient, it is almost say in first 24 to 48 hours, we are able to most of the patient, we are able to formulate that this kind of disease he is suffering from. So we give a broad idea to the patient attendant and give them a disease, explain them about the disease nature, and take in the writing also. This is the most important thing which I used to do when I was there in the private setup. Now here my residents are doing it, and this is quite useful. They know that this has been explained to me or someone, because it happens quite often that one attendant comes today and he just walked out tomorrow, and the new attendant comes. He says that मुझे तो कुछ नहीं बताया. This happens in a day-to-day practice. So मुझे तो कुछ नहीं बताया. We have explained to you on paper. This is the nature of disease, and it is in with the patient file. So this is important. This is very important nowadays, especially in medicine. As we are looking after medicine ICU, we are doing for all patients. In ward also, we are having quite sick patients. In those patients, we are maintaining it. This is very important to explain the nature of the disease, and this will definitely decrease the aggression of the patients attendant, because they are anxious too. They want to know ठीक हो जाएगा. उनका सिर्फ एक ही क्वेश्चन होता है, ठीक होगा कि नहीं. चाहे आप उनको ये भी बता दो कि अगले 2 घंटे में पेशेंट एक्सपायर हो जाएगा, ठीक होगा कि नहीं. मतलब माइंड में भी कि we they are in the that neuronal block. They cannot think about that कि ऐसा भी हो सकता है कि मेरी वाइफ, मेरा बच्चा, मेरे फादर एक्सपायर भी हो सकते हैं. दिस इज द स्टेज ऑफ डिनायल. दिस इज द स्टेज ऑफ डिनायल वेयर सेज कि नहीं, ऐसा कैसे हो सकता है, कल तो ये बिल्कुल ठीक था, या अभी तक तो ये ठीक था, ये कैसे हो सकता है. It is a human nature basically. So we should be dealing it professionally by explaining them proper prognosis in a written way.
Yes, sir. Thank you, sir. Thank you for the brief explanation.